Busting common myths around knee replacement surgery. Myth 1. Prolonged bed rest is involved. Same-day standing and walking a few hours after surgery is possible, reducing bed rest to 0 after surgery. Myth 2. Will be dependent on walker crutches stick after knee replacement. Walking only the initial few steps after surgery needs support, after which the patient gradually leaves the support on, gaining strength and confidence. Myth 3. Prolonged hospital stay is needed. Due to our fast-track protocols, advanced surgical technique and anesthesia leading to a painless procedure, patient has an accelerated recovery. Hospital stay is minimized to hardly 2 or 3 days. Myth 4. It will not be possible to climb stairs after surgery. Stair climbing is encouraged and started soon after surgery during hospital stay itself. This enables the patients to climb their own stairs while going home. Myth 5. Knee doesn't bend completely after surgery / patient can't sit cross-legged after surgery. Achieving good knee flexion and mobility after knee replacement surgery depends on factors like surgical technique, implant quality, and post-operative rehabilitation. Myth 6. A lot of stitches are put during surgery which are painful on removal later on. Most of the times patients get a stitchless surgery where dissolvable stitches are put and hence no stitch removal is needed. Myth 7. One cannot lead an active lifestyle after knee replacement. Dancing and running after knee resurfacing surgery. Myth 8. Knee replacement is just like the replacement of the kidney or liver. They will remove my whole knee and insert a new knee. Knee replacement is technically more of a knee resurfacing or repair procedure, as it involves replacing worn-out cartilage with artificial caps on the bones, rather than replacing the entire knee joint. Myth 9. I am allergic to metals / lot of food etc. My body may not accept the metallic knee. Due to availability of hypoallergic knee with special coating of TNBN or gold knee, even people with metal allergies can undergo TKA. Myth 10. I am too old for surgery. Age does not matter for an operation. If you are clinically fit, then elderly patients can easily undergo joint replacement surgery. Some patients underwent joint replacement even at the age of 95 years and are happy with the operation. Myth 11. Knee replacement surgery has a high risk of failure. The only major risk in the whole surgery is infection. The chances of having an infection are less than 1%. This risk is reduced by following sterility protocols and antibiotic coverage.